Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, let's talk about scoliosis. Scoliosis is one such deformity that could lead to lifelong suffering related to aches and pains, especially back pains or else upper back pain. Hence, it's important that scoliosis should be identified and treated well. So what exactly is scoliosis and how its management is planned? We're going to discuss all of that in today's video. So make sure to watch this video till the end. Let's begin. The meaning of scoliosis, it means increase in the lateral curvature of the spine. Mostly our spine is curved in a longitudinal way, but when this curve becomes S-shaped or C-shaped, then it is called as scoliosis. Scoliosis could be caused either by idiopathic reason, which means when there is no known cause for it. Scoliosis could be congenital, which means that a person has scoliosis since birth, or a scoliosis could be neuromuscular, which means following a neurological disorder, person develops scoliosis. In all of these cases, scoliosis is a condition which stays common and leads to multiple symptoms. Some of the commonest symptoms of scoliosis are increase in the lateral curvature of spine. The body has sideways posture. A person will have one shoulder raised little higher compared to other. Person's cloth fitting will not be proper and it will look as if they are hanging. Patient will often experience local muscular aches and pains. Patient might also easily develop ligament injuries. And last but not the least, person might develop decreased pulmonary function or else lung function. Since there are multiple reasons why a person develops scoliosis, as well as there are different types of scoliosis as well, it's very important that first the scoliosis should be identified from its cause or else why it happened, and later on what type of scoliosis and at what level it exists. Basis that only the treatment program is designed. Some of the simple tests that a doctor might prescribe you: raise spine, some physical examination test, history, some observation or else clinical palpation techniques, as well as sometimes they might also prescribe you CT scan and MRI scan if it is showing neurological symptoms as well. Coming to the management, mostly the management of scoliosis is conservative. Surgical options are rarely used, but when used, it's used when the person's day-to-day ability is getting impacted. If the degenerative changes or else there are some bony fusions or else the scoliosis has become fixed, and if this scoliosis is causing neurological symptoms or affecting person's day-to-day life. Apart from that, when we look at the conservative management of scoliosis, the key is first to use braces or special beds. Mostly the commonest bed used for scoliosis management is Milwaukee brace, which is advised for the patient to wear, and then gradually it is tapered as patient develops improvement in the scoliosis levels. Along with that, the second method is exercises. Exercises plays a very crucial role when it comes to management of scoliosis. The scoliosis exercises basically comprises of breathing exercises as lung function is affected. One side of lung expansion is better than other side, which needs to be coordinated. Second important is posture correction exercises. It is important that exercises the exercises focuses on improving the posture of a person. Third, stretches. Stretches plays a very crucial role as these patients usually have a combination of muscle weakness as well as tightness. Hence, stretches needs to be given over the tight muscle and strengthening program needs to be done over the weak muscles. Mostly people who suffer from scoliosis show weak abdominal muscle. Hence, doing abdominal exercise is also a very important part of scoliosis management. And along with that, some physical activities which improves body's alignment and functions like yoga, swimming, Pilates is usually prescribed for the patient as a long-term management method. Scoliosis, once corrected, needs to be maintained, and that's why a person who suffers from scoliosis needs to stay active and stay functional and do regular exercises so that the scoliosis symptoms doesn't flare up as well as the scoliosis itself doesn't worsen. With regular exercises, person can not only maintain a good lifestyle but also prevent himself from some secondary complication that person can easily develop due to scoliosis. Now, we would be talking more about scoliosis in upcoming video. So if you who are someone who is suffering from scoliosis, make sure to follow our channel HealthQ for more such information. I'll see you in another video.